So we're going to talk about these devices that you see behind me today. And these are used for patients who have bleeding in the gastric area or the esophagus, two places you really don't want to bleed. And unfortunately, when these patients bleed, it's really bad. I have a video at the end, so stay because you will be amazed at how fast and large of a quantity these patients can bleed. So there's three types of tubes that we can use. The Linton tube I don't see as often, and that's because it has a single balloon. You can see here. So basically, it just has one balloon that's going to sit in the gastric area or the stomach and essentially tamponade off bleeding that's occurring in that area. The other two tubes that you see are the Blakemore and the Minnesota tube. And those have two balloons. So you see the gastric balloon, and then you see this longer one. That is an esophageal balloon. So that literally means that I inflate that balloon and it's going to tamponade off whatever vessels are bleeding in the patient's esophagus. And this typically will happen in patients who have liver failure, and it leads to portal hypertension. And that hypertension, right, that buildup of pressure will literally make the smaller veins start to try to get flow from somewhere else. So they start to enlarge, right? They're trying to perfuse. Unfortunately, what it does is it essentially forms what you would call a varicose vein. So if you think of someone who has varicose veins in their legs, they're big, bulging, they're really close to the surface. That's exactly what's happening. It's just happening in the stomach and it's happening in the esophagus. And these are really high risk for bleeding. And when I say bleeding, I mean bleeding bad. So the difference, again, is those balloons that you see here. So one balloon and the other have two. And then the other difference is between the Blakemore and the Minnesota are the number of ports. And you can see them up here. So the red guys. And I'll show you a closer image so you can see what I mean. So this is an image of the ports of a Minnesota tube. So the Minnesota has the four, and the one that it has extra is an esophageal aspirate port. And again, you might be like, why would I need that? Well, right, I have a patient, I'm tamponading off that bleeding that's occurring in the esophagus. I might want to check if they're still bleeding before I put that balloon down, right? So what we'll do is we'll pull back on that aspirate port and see, am I getting a bunch of blood or nothing? If I'm getting nothing, the hope is that I'm not bleeding anymore. I can put that balloon down and we're good to go. The problem with these two is I don't want to keep this balloon up for an extensive period of time because it can cause damage to the esophagus and the stomach. So that's something we really have to think about. The other thing we think about with these patients is traction. And you're like, traction? Why do I need that? Well, if we don't have traction, so something pulling on the end of that tube, the balloon will just slide down, right? There's nothing holding it up. So we need to have traction. And typically what you'll see is something like this. It will be tied to a saline bag and slung over an IV pole. Totally fine. There's other ways though that we can keep traction on these, and I'm going to show them to you. So this is another way, and it's a football helmet, which is kind of funny to see a patient in the ICU who's intubated, very sick, wearing a football helmet for the first time. But basically, you can see the tube here. We tie it to the face mask of the football helmet. So it doesn't matter which way the patient moves, their head, anything, that still has traction on it, which is important. The one I like to use in the transport world is actually a Hollister. And you've seen these before because, right, our patient's intubated. That's their ET tube. That's the Hollister. All I did was I take a clip off of another Hollister and I literally clip it just like I would an ET tube, but I clip it to the Minnesota or the Blakemore tube. This keeps traction on the tube and there's not really a risk of that tube getting pulled out, obviously, but losing traction. So the balloon essentially slides down and it's not where it needs to be. So these are some of the things to think about when you see these tubes. Those are the differences that we talked about. And now I'm going to show you that video of the bleeding because your mind will be blown.